Hello, this is Dr. Gil Wilshire at Missouri Fertility. Welcome to our discussion series. Today we're going to be discussing male fertility. Now, this is good advice for any man, but it is particularly geared for men with low or poor sperm counts or poor semen parameters. Now, you need to realize it takes a long time to make a sperm. It takes 3 months to make a sperm and 9 months to see full recovery from any insult or condition. So it's never too early to start trying to get healthy. You need to optimize your health, and there's several basic ways to do that. One is obviously through nutrition. We have a whole video on that, and I recommend you look at our video called Nutrition Basics. There may be a role for supplements and vitamins, etc. for men. There's a separate video on that topic as well. Today we're going to be talking about the foundation of male health, which should optimize male fertility. First of all, guys, you got to get sleep. Regular sleep is really crucial. Men in particular have a boost of growth hormone early in the sleep cycle. If you don't have that burst of growth hormone, you're seriously hurting your health in a number of ways. It's very important to get sunlight every day that you can. Sunlight makes way more than just vitamin D. It has a whole bunch of other benefits, including prompting and optimizing your circadian rhythms. The hormones that go up and down during the day, cortisol, thyroid, other related hormones, are all crucially important for health and your fertility. An easy way to optimize your growth hormone and testosterone levels is to lift some weights. Now, you don't have to become a total gym rat, but a somewhat regimented, fairly regular weightlifting program is very, very good for men. Once or twice a week is pretty much all you need. Now, you don't need a fancy gym membership. On a small square of floor, you can do push-ups, planks, squats, and do some basic exercises almost anywhere you are, almost any time you want to do so. Now, there are toxins in the modern environment. There are pesticides in well water. There's mercury in the air. God knows where all these toxins come from, but they are everywhere. Obviously, you should minimize the number of toxins that you put into your own body. Chewing tobacco, smoking, excessive alcohol, these are obviously obvious places to start. In the environment, it can be a little trickier. If you suspect your water is not clean, perhaps bottled water or filtered water might be good for you. Toxins can enter the body not just through the mouth and the gut, but through the lungs and through the skin. Mechanics and whatnot that get petrochemicals on their hands, I call it black crack syndrome. These guys can never get this black stuff out of the cracks in their hands. Well, this gets into the blood and is toxic, so beware topical exposures. If you're breathing smoke from welding, other toxins, auto body guys breathe in a lot of toxins from paints and whatnot. These can all poison the body and can seriously affect your sperm counts and your sperm numbers. Now, there's this constant discussion of boxers versus briefs. Does heat affect sperm production? Well, the testes would not be outside the body unless lower temperatures were advantageous to sperm production. Now, I don't think wearing briefs during the day has that much of an effect. But if you do wear briefs, wear them just during the day, take them off at night, sleep without them. That would be a logical place to start there. It certainly doesn't make sense to sit in hot tubs for a long time. If you sit in a hot tub, make it brief, especially if you're trying to have kids. Keep the temperatures down as best you can. There are guys who work in kitchens that are very, very hot. Perhaps truck drivers who sit in a hot cab that's confined may have heat issues. So use common sense, minimize heat wherever you can. But does boxers make that much of a difference in the scheme of things? Hard to say. Another important thing to do, guys, is reduce the belly fat. Belly fat increases the hormone estrogen. Estrogen might be good for the gals, but not good for the guys, and it's very harmful to sperm counts. If you need to get rid of the belly fat, cut the carbs, get rid of the grains, get rid of the potatoes, minimize the alcohol, especially the beer, lower the belly fat. This will have very good effects on your sperm numbers, usually pretty rapidly. Another important topic, minimizing medications. You'd be surprised how many common medications can affect fertility. Chronic use of antacids can result in nutritional deficiencies. Statins, which are supposed to lower cholesterol, can also lower sperm counts dramatically, and we've seen great improvements in men who simply stopped statin medications. Obviously check with your doctor first before you do this, but if you explain to them this is temporary and we're trying to make a baby here, perhaps there's other things you can do and other things you can take to avoid taking statins. Antidepressants. These are important for some people, but they can also cause what are called ejaculatory dysfunctions, and in some guys these can seriously affect sperm count. So if you can minimize these medications, that would be to your advantage. High blood pressure medicines also have issues. So if you can minimize meds, frequently we'll see some rebound in 3 to 9 months, as I mentioned. Now, guys, when you've been trying to have babies, this can kill the romance in the relationship. We realize this, and it's not uncommon. It's very important that you guys and gals keep the love alive, all right? Take care of each other, be romantic, be sensitive to these issues, and try to be as romantic as possible. For guys, this has been shown to increase testosterone levels, and it's really good for mood and for your relationship. So when you're trying to have a baby, do not forget that romance and love and companionship and good, strong relationships is very important on many, many levels. So, in summary, it's never too soon to start trying to get healthy. There's some basic things all guys can do to improve their sperm counts, and hopefully with some good guidance and some support from each other, you can do what's necessary to improve your sperm counts and hopefully maximize your fertility. I hope this is helpful. This is Dr. Wilshire at Missouri Fertility. I hope you found this video helpful. Please feel free to like us on Facebook, subscribe to us on YouTube, and follow us on Instagram.